My name is Janice Hamscher, and I will be the Chief Nursing Officer here at Altru beginning on February 6th. When I came here for my first interview, I found people to be so passionate about their work. You know, I grew up and I've always wanted to be a nurse. And I don't know why. I don't have a lot of nurses in my family, but that is just what I always wanted to be. I have two young adult sons. My older son, Eric, is 27 and lives in Philadelphia and is actively working to get into medical school right now. And my younger son, Jared, is 25 and finished a nursing program last year. I enjoy reading. I like to cook on the weekends. I don't enjoy it during the week. I think my favorite food is probably chocolate. If I had to think about one thing that I probably wouldn't be able to give up, that's what it would be. My main role model probably was my mother. You know, I just kind of always wanted to be like her, and I think I've achieved that. You know, if I'd say, oh, I can't do that, she'd say, well, why can't you do it? You can, you know, why? Why can't you do it? You can do anything. You do anything you can make up your mind to do. You can have stumbling blocks that could make you maybe rethink that or be a little discouraged, but if you keep your eye on the goal and never give up, you get there. And you know, you feel such a sense of satisfaction from having done that. So I think, you know, never ever give up is something that, you know, will run through my mind occasionally. My philosophy of nursing really is centered around the patient, so patients come first. I feel very strongly that nurses have to continue their education. Patient care changes all of the time, and by continuing that learning process, nurses continue to be knowledgeable, highly skilled, and I also believe that continuing education keeps nurses passionate about what they do because you're continuing to learn, continuing to grow. You know, with accountable care, there will be a shift of more patients moving to that outpatient side of the continuum of care. So for the inpatient side, the inpatients that will be here will be more acutely ill, which means that inpatient nurses, their skills are going to have to be exceptional because the acuity is going to rise while the patient census may actually decrease. Nurses in other outpatient settings serving in the role of health coach and patient education and really helping patients and families understand what their plan of care is and what is that trigger that motivates that patient to be compliant so that they can have their optimum health. So, you know, nursing is going to play a very key role in the future of healthcare as it continues to evolve into that accountable care model.